Now let's talk about B-mode ultrasound imaging. B-mode is the most commonly used mode of ultrasound, and the B stands for brightness. Essentially, the pressure amplitude, which is received by the transducer, is converted into the intensity or brightness that you see on the ultrasound image. What about interfaces that aren't perpendicular to the direction of beam propagation, where the ultrasound beam won't be reflected directly back to the transducer, but might be refracted off in a different direction? Well, to account for this, compound B scanners have been developed, which essentially superimpose images from different directions to compensate for the effects of refraction and these non-perpendicular boundaries. Linear arrays and curvilinear arrays are often used to help us quickly get the images that we want for ultrasound. Essentially, a linear array stacks up many small piezoelectric elements which each can create their own ultrasound beam. This is useful for many reasons. First of all, if there are obstructions in the beam path, such as the ribs, which would reflect almost all of the ultrasound, the smaller elements allow you still to get penetration into the tissue in the gaps between the ribs. Additionally, by having all of these elements lined up, we can quickly get a large beam profile, shown here. At the right, we have a couple of B-mode images. This is one of the earliest B-mode images created. It's of a fetus. You can see the head here and body down below. Here is a more up-to-date image of using a linear B-mode scanner. So my question is, as far as resolution is concerned, is it desirable to have large elements or smaller elements? Let's talk about it. Well, first off, when we look at the beam pattern that comes out of a single element, you might think, well, we want a small element so that our spacing can be tighter and that the beam will be smaller, we'd have better resolution. Unfortunately, the beam path of an ultrasound element diverges quite quickly for a small element, where a larger element transducer may have a wider beam path initially, but it also diverges more slowly. In the far field of the ultrasound transducer is where we typically do our imaging. Because of that, it makes it desirable for us to have a larger aperture ultrasound transducer for each element. On the flip side, resolution is limited by the spacing of elements as well. So if we have larger elements forcing us to have larger spacing, we'll get poorer lateral resolution. What can we do to compensate for these seemingly opposite effects? Well, there are two things that we can do. First off, in our linear array, we will fire multiple elements simultaneously to increase the effective aperture and mitigate the effects of beam spreading in the far field. By shooting multiple elements at once and then sliding over a single element and shooting with the next set of elements and moving across the transducer in this way, our spacing can be much smaller than it would if we had simply large elements with large aperture. The second thing we can do to improve lateral resolution is to use signal delays, time signal delays, so that we can focus the ultrasound beam. The idea here is that by applying these delays, we can steer the ultrasound beam to look specifically at a location where we would want to see. This is just like a magnifying glass focuses light so that you can see something much more closely. By steering the ultrasound beam to the correct depth and location that you want, you can get much tighter lateral resolution. What are the applications of B-mode ultrasound? Well, to be honest, there's way too many to name. They range from guiding an anesthesiologist placing a peripheral nerve block, to monitoring the development of a growing fetus, to identifying cancerous tumors in the liver. The important thing for us to remember and recognize is that the ability to look into the body non-invasively makes B-mode ultrasound a very powerful and very ubiquitous diagnostic tool. I'll quickly go through a couple more of the modes of ultrasound before we get to Doppler imaging. The next is C mode. C, I'm not sure what it stands for, but it's through transmission imaging. Here we're not using a pulse and its echoes, but actually we're having a transducer on both sides of the object that we're interested in imaging. Today, C-mode imaging is used to measure the attenuation and speed of sound of different materials and tissues. A primary application in the body is breast tomography. Next is M-mode imaging. M stands for motion. M-mode ultrasound imaging is a combination of A mode, which helps us to get the depth along a single line, and B, in which the tissue interfaces are displayed as a brightness in the reflections. M mode displays this one-dimensional information as a function of time. I'll use this schematic as an example. Well, this ultrasound image is an example. Here at the top we have a conventional B-mode image with 3 different rays identified, which are used for the M-mode images below: A at the left ventricle, B at the mitral valve, and C at the aortic valve. Along each vertical distance we see different reflections from different depths. Anything that along the horizontal doesn't change very much is an indication that that tissue isn't moving. However, when the tissue is moving with time, we see a change in waveform. Here, the left ventricular wall, here, the mitral valve, and on the right, the aortic valve is moving. Analyzing these can help us to identify different diseases and disorders of the heart.